This is a presentation on the history of medicine in Cape Breton for a 200-year period from 1784 to 1984. It is presented by the Medical History Society in Nova Scotia, who are funded by three organizations, Doctors Nova Scotia, the College of Physicians and Surgeons, and the Faculty of Medicine. When people ask me questions about the history of medicine, they typically ask me things like, who were the medical practitioners in Cape Breton? Where did they get their training? What diagnostic methods did they use? How was mental illness treated during the period? Well, one of the first doctors to come into Sydney came on the ship that brought the first settlers to Sydney in 1784. He was Dr. William Smith. And why was he there? Well, he was a debtor. He had so much debt or owed so much debt that he had to leave England, and he came to Sydney. And he stayed in Sydney many, many years and established a hospital, which is shown on this first plan of the town of Sydney, 1786. And if you know Sydney, you probably know where George Street is, and the Esplanade, and the hospital was very close to, in fact, between those two. You can see it better here. It has its letter number H in the plan that you're looking at right now. Now, a hospital at that time, of course, was really just a small house with probably 8 or 10 beds, so it wasn't an elegant thing that would be similar to what we have today. This was a book that had been written by Dr. Smith in 1768. He had written 10 books on aspects of medicine before he came out to Sydney, and a very accomplished doctor, but he owed so much debt that he had to leave because they were trying to put him in jail. And he stayed in Sydney until about 1900. He was followed by a large number of doctors that you see in this list, most of whom were educated in Edinburgh and in Dublin and in Glasgow, some in New York, the later ones, as you'll see at the bottom of the screen, in Harvard and so on. And they didn't stay very long in Cape Breton because they really couldn't make much of an income. Two long-serving doctors in Sydney and Sydney Mines are Dr. Johnston from Edinburgh and Dr. McGillivray from Bellevue Medical College in New York. And fortunately, I've been able to find photographs of these gentlemen. Another interesting doctor was Dr. Thomas Jeans, who was from Cork Island and had studied at Glasgow. And he was the first person to write an exam to become a medical doctor in Nova Scotia in 1829, and he passed. And he had his own drugstore in North Sydney. And here's his picture. He looked like an interesting person. Another person that came out and went to the western side of Cape Breton, Port Hood, was Dr. John Noble, who was born in Inverness and studied at St. George's Hospital. And he became health officer for Canso, surgeon in the Cape Breton Regiment, had 9 children. And some early doctors in Ayrshire in Richmond County. They came there because of the Jerseymen from the Isle of Jersey. They set up a business in Ayrshire and brought in a lot of workers, so they needed doctors, and these two gentlemen came in and stayed there the rest of their lives. Now, when you think of the practice of medicine, you have to understand that before 1870, medicine was really not what you'd call scientific at all. It was either allopathic or alternative. Allopathic means all diseases were treated the same. And unfortunately, that meant that people weren't treated very well. A number of measurement methods that were used at that time, very few in fact, the stethoscope was the most important, but even though it was invented in 1816, it didn't come into use until the 1840s. Around 1867, Louis Pasteur not only showed how to pasteurize milk, but he also pointed out there's such a thing as bacteria. And this bacteria can infect surgical wounds. So Dr. Joseph Lister at Edinburgh came up with the idea of trying to prevent infection of wounds. Now, at that time as well, there were a lot of infectious diseases. Cholera, consumption, diphtheria, scarlet fever, typhoid fever, whooping cough, and also some viral diseases. Measles and smallpox, of course, were the most rampant. And the doctors that came after Lister and time, like Dr. Dodd, they practiced with a knowledge of bacterial diseases, and they were much more efficient at curing patients. Practiced medicine for 58 years. Dr. Kendall was a doctor in Sydney. He had attended Mount Ellison and Bellevue Medical College, also studied in London, and he was very involved with the Halifax explosion. In fact, he was chairman of the Medical Relief Committee for the Halifax explosion, became an MLA and an MP, and became a very important person in that part of Nova Scotia. These two doctors are very highly revered in Baddeck. Dr. Bethune is the progenitor of all the Bethune doctors in Nova Scotia. And there are two doctors practicing in Halifax today who are his great-grandchildren. During the Halifax explosion, Sydney immediately reacted and sent 14 doctors and 27 nurses to Halifax the morning of the explosion on the train. And of course, when they got here, they were very, very important in helping with the injured in the Halifax explosion. Very important thing in medicine, of course, was the development of hospitals. And that begins around 1888, 1889. St. Joseph's Hospital opens in Glace Bay in 1902. And then we have a number of other hospitals in Sydney, Sydney Mines, North Sydney, and so on. St. Joseph's Hospital had 50 beds. It was the largest hospital outside of Halifax at the time, started by the Sisters of St. Martha, which was an Antigonish order of sisters. Very important order, and done some marvelous things for Nova Scotia with respect to educating nurses and providing nurses. This is the hospital at Sydney Mines. It wasn't the estate of Graham Fraser. As you can see, a very elegant house. He donated his house to become the hospital at Sydney Mines, opened in 1908 with 22 beds. And we owe a lot to him, or at least Sydney Mines does. This is a hospital that was donated to Sydney by the Ross family, opened in 1920 with 25 beds, and they were able to get the Sisters of St. Martha's from Antigonish to come up to Sydney and operate the hospital for the town, which was a wonderful thing for the Sisters of St. Martha's to do. They also ran this hospital in Inverness, the St. Mary's Hospital, which opened in 1925 and established by the Stella Maris Parish, Roman Catholic Parish. The building on the right is the TB Annex. You'll notice it's completely isolated from the hospital. Now, there are also people who in Sydney and Sydney River who had mental problems, so they established an asylum. That was the word that was typically used where mental patients lived. 100 patients were living there in 1910. Another asylum was opened up in Mabou, opened in 1924, and burned in 1947. Now, that's a large, large building. You would expect that somebody would have burned to death, but that wasn't the case. They all got out. They made sure they had good fire escapes. Everyone got out before the place burned down. So that's the end of my story about medicine in Cape Breton. Thank you.